All right, so we're diving into some fascinating stuff today. Eye conditions that can really impact your vision.
Yeah, like glaucoma, retinal detachment, macular degeneration.
Serious stuff. So let's start with glaucoma. What exactly is going on there?
Well, glaucoma is often called the silent thief of sight.
Oh, wow,
It
dramatic.
is
Yeah.
because it's a leading cause of blindness,
Really?
and it can sneak up on you. It all boils down to pressure inside the eye, specifically on the optic nerve.
Okay, the optic nerve.
Yeah, the one that connects your eye to your brain.
Right, so if that nerve gets damaged.
Exactly. It can disrupt the visual signals being sent to the brain, and that leads to vision problems.
That makes sense. And there are different types of glaucoma, right?
Yeah, there are two main types to be aware of: open angle and closed angle.
Oh, okay, so what's the difference?
You could think of it like a drain in your sink. In open-angle glaucoma, the drain is partially clogged, so fluid builds up slowly.
Ah, so the pressure increases gradually.
Right. And this type is often painless, but you might start to lose your peripheral vision.
Like looking through a tunnel.
Exactly.
That's scary.
It is. Now, closed-angle glaucoma is a different story. It's a sudden and complete blockage.
Oh, so the pressure spikes rapidly.
Yeah, it's an emergency situation.
Wow. Okay, so open angle is sneaky and gradual, while closed angle is a sudden emergency. Got it.
Exactly.
Now, the notes mention a bunch of things to avoid after surgery for glaucoma, like a whole laundry list of don'ts.
Right after glaucoma surgery, the main goal is to keep that eye pressure down. So anything that strains or puts pressure on your head is a no-go.
Like,
Coughing, sneezing, bending over, even straining on the toilet.
oh, wow.
Yeah, sorry for the TMI.
No, it's important. And I see here that certain medications are also on the no-no list, anticholinergics.
Right, anticholinergics like atropine and ipratropium can actually make your pupils bigger.
And that's bad because...
It can block the flow of fluid in the eye and increase pressure.
Ah, the opposite of what we want after surgery.
Exactly.
So how do they even measure the pressure inside the eye?
It's called a tonometry test. It's quick and painless. The normal range for intraocular pressure, or IOP, is between 10 and 21 millimeters of mercury.
Yep, anything higher than 21 is a red flag.
Okay, so what if someone's IOP is too high?
Well, medications can help. A common one is timolol.
Timol.
It's a type of beta blocker. It slows down the production of fluid in the eye.
Okay, so it's targeting that pressure directly.
Right. Another medication, mannitol, is a powerful diuretic that's often used in emergencies.
Why mannitol specifically in emergencies?
Think of mannitol as a tiny sponge that draws excess fluid out of the eye. It brings down that dangerously high pressure fast.
Wow, so it's like a lifesaver for the eye.
Pretty much.
And I have to say, I love that memory trick in the notes. Closed door equals closed angle.
It is a good one.
Helps to remember the urgency of that type of glaucoma. Okay, so we've covered glaucoma and that whole pressure issue. But what happens when the retina, like the back of the eye, starts to detach?
You can imagine the retina as wallpaper lining the back of your eye.
Okay, I'm visualizing it. Retinal detachment is like that wallpaper starting to peel away.
Yeah.
And when it does, you get all sorts of visual disturbances.
The notes mention a feeling of a curtain closing over the eye.
Yeah, that's a classic sign.
Wow, so it can be very dramatic.
It can. As the retina detaches, it blocks light from reaching certain parts of the eye, creating that curtain effect.
I see. But it's not always that dramatic, right?
Right. Some people might experience flashes of light or floaters in their vision.
Floaters?
Yeah, like little cobwebs or specks drifting around.
Interesting. So what actually causes the retina to detach?
Well, aging can play a role, but trauma's a big one too.
Trauma-like?
Getting hit in the eye with something, or even whiplash from a car accident, anything that jolts the eye.
So not just something that happens to older folks then?
Nope, it can happen to anyone. And the source material really emphasizes those priority symptoms:
Which are?
sudden vision loss, pain, and flashing lights.
Got it. Those are the red flags.
Exactly. If you experience any of those, seek medical attention immediately.
Okay, no messing around with those symptoms.
Nope. Early detection and treatment are key.
And speaking of treatment, what happens after surgery for retinal detachment? Are there a lot of things to avoid, like with glaucoma?
Yeah, we want to give that retina the best chance to reattach and heal. So after surgery, anything that could strain or put pressure on the eye is a no-go.
So like coughing or sneezing, which we talked about with glaucoma. What else?
Now, rubbing or scratching the eye, even if it's itchy,
All right, thank you.
and no intense focusing activities for a while.
Whoa.
Reading, watching TV, using a computer, basically give those eyes a complete vacation.
Wow, vacation for your eyes. I like it. Okay, so we've covered glaucoma, where pressure is the enemy, and retinal detachment, where the retina literally comes unglued. Now let's move on to macular degeneration, which we know is a leading cause of vision loss, especially in people over 60.
That's right. Macular degeneration affects the central part of the retina called the macula, which is responsible for sharp, detailed vision.
The kind we need for reading and driving and recognizing faces.
Exactly.
The notes mention a memory trick. Middle vision loss equals macular degeneration. Catch.
It is. And it highlights the core issue here. When the macula deteriorates, it's like having a blurry spot right in the center of your vision.
So everyday tasks become a lot harder.
Yeah, they do.
And this isn't just something that inevitably happens with age, right?
Not exactly.
What?
While it's more common as we get older, macular degeneration is a disease process, not just normal aging.
Okay, so it's important to distinguish between those two things.
Got it. And speaking of things that should raise a red flag, the notes mention a blurry spot in the center of vision as a key symptom.
Right, if you're reading a book or watching TV and a blurry patch appears in the middle of your vision, that's a sign you need to see an eye doctor immediately.
Wow, okay, so don't dismiss those changes as part of getting older.
Exactly. Early detection is crucial.
Okay, so we've covered 3 very different conditions. Glaucoma, with its pressure problems, retinal detachment, where the retina literally peels away, and macular degeneration, which affects central vision. It's a lot to take in.
It is, but understanding the differences is crucial for getting the right diagnosis and treatment. What stands out to you most about these conditions so far?
I think what strikes me is how interconnected they are. It's not just about one problem in isolation.
You mean like...
Well, retinal detachment can be a complication of other eye conditions like glaucoma, and certain medications for one condition can have implications for another.
So the eye is kind of like a delicate ecosystem. Everything's connected,
Exactly.
which makes it even more important to have regular eye exams and be aware of any changes.
I completely agree. Regular checkups are key to catching these conditions early and protecting our vision.
Speaking of checkups, I'm curious about those laser treatments mentioned in the notes for glaucoma.
Oh yeah, those are pretty cool. They target the cells that produce aqueous humor.
Aqueous humor.
It's the fluid inside the eye.
Ah, so the laser helps manage the pressure that way.
Exactly.
It sounds less invasive than traditional surgery.
It is. It's a great example of how medical advancements are becoming less invasive, but still effective.
Now, going back to retinal detachment for a moment, I'm struck by how diverse the visual disturbances can be. It's not always just that dramatic curtain closing sensation.
You're right. It really depends on how the retina detaches.
So tell me more about those other visual distortions.
Well, some people describe it as hairnet-like vision, while others experience flashes of light or those floaters we talked about earlier.
It's almost like a kaleidoscope of visual effects.
Yeah, in a way.
And it's these subtle symptoms that people often dismiss, which is why raising awareness is so important.
Exactly. The more you know about these potential red flags, the better equipped you are to take action.
Knowledge is power.
Absolutely.
Now let's circle back to macular degeneration. I really like that memory trick with the 2 M's. It helps to remember that the core problem is middle vision loss.
It's catchy and effective.
And it really highlights why this condition can be so debilitating, because central vision is crucial for so many things.
It is. When that starts to deteriorate, things we take for granted become really challenging.
Like just seeing people's faces.
Yeah, exactly.
And there's no cure for macular degeneration currently, right?
Unfortunately, not yet.
Uh-huh.
But there are treatments that can slow the progression and help manage the symptoms.
What kinds of treatments?
Well, one option is medications injected directly into the eye.
Into the eye.
Yeah, to inhibit the growth of abnormal blood vessels that contribute to the condition.
Wow, okay.
And there are also low vision aids devices that magnify images to help people with vision loss make the most of their remaining sight.
So while it's a challenging condition, there is hope. And the fact that research is ongoing is encouraging.
Absolutely.
You know, thinking back to that blurry spot symptom, I can see how easy it would be to overlook or dismiss it.
Yeah, people might think they just need new glasses or that their eyes are tired.
But if it's macular degeneration, early intervention is key.
Absolutely. That's why it's crucial for people, especially those over 60, to be aware of this symptom and report it to their doctor right away.
They could make all the difference.
It could.
It seems like early detection is a recurring theme in eye health.
You got it. It's key for so many conditions.
Okay, so we've covered the symptoms, causes, and treatments of these 3 eye conditions. It's a lot to absorb.
It is.
But the main takeaway for me is the importance of awareness.
I agree. Knowing what to look for when to seek help and how to protect your eye health can have a huge impact on your vision and your quality of life.
And speaking of protecting eye health, I'm curious. Is it okay to exercise if you have one of these eye conditions?
That's a great question, and the answer, as with many things in health, is it depends.
Okay, on what?
First and foremost, talk to your doctor. They'll assess your specific condition and advise you on what's safe.
So no hitting the gym without the green light.
Exactly. Assuming you do have the okay from your doctor, the type and intensity of exercise are important considerations.
So, for example,
Well, if you've had retinal detachment surgery, high-impact activities might be off limits for a while.
makes sense. You don't want to jar your eye after surgery.
Exactly. But gentler exercises like walking, swimming, or cycling might be perfectly fine. It's about finding that balance between staying active and protecting your eyes.
I like that approach. It's empowering, not restrictive.
That's the key, right?
And I imagine there are ways to modify exercises if your usual routine is off limits.
Oh, absolutely.
Hmm.
There are always alternatives and modifications.
Yeah.
It's all about adapting and finding what works for you.
I love that approach. We focused on these 3 specific eye conditions, but what about other factors that can affect vision? Like, I know diabetes can have an impact, right?
You're right. Diabetic retinopathy is a serious complication of diabetes that can damage blood vessels in the retina and lead to vision loss.
So it's another layer of complexity.
It is, and it highlights how interconnected our health really is. What affects one part of our body can have ripple effects elsewhere.
So managing chronic conditions like diabetes is important not just for overall health, but for protecting our vision too.
Absolutely. And those regular eye exams we talked about are especially important for people with diabetes.
To catch any early signs of problems.
Exactly.
Okay, I'm taking notes. Regular checkups, a healthy lifestyle, managing any underlying conditions. It all comes back to a holistic approach.
You got it. It's about taking a proactive and comprehensive approach to protect our precious sense of sight. Welcome back. It's really amazing when you think about it.
What's that?
Just how many intricate parts are working together to give us sight.
It's true. We've been talking about how those parts can go wrong with conditions like glaucoma, retinal detachment, macular degeneration.
Yeah, a lot to process.
It is, but it's fascinating stuff.
It is. And understanding these conditions helps us take better care of our eyes.
Absolutely. Speaking of taking care of our eyes, what are some things we can do to protect our vision even if we don't have any eye conditions yet?
Well, the foundation of good eye health is regular eye exams.
Like getting an oil change for your car.
Pretty much. Helps prevent major problems down the road.
Okay, but how often are we talking?
It really depends on your age and risk factors. For most adults with no eye problems, an exam every 1 to 2 years is a good starting point.
Got it. So mark those calendars, folks. What about for people who already have glaucoma or macular degeneration?
They'll need to see their ophthalmologist more frequently, maybe every few months, just to monitor their condition and make sure the treatment plan is working.
So it's all about personalized care, like with any other health issue.
Exactly. Now, beyond those checkups, there are some simple, everyday habits that can make a big difference.
Let me guess. Eat your vegetables.
Haha.
Yeah.
Well, you're not wrong. A healthy diet is crucial for overall health, including our eyes.
But what else is on that list of vision-saving habits?
Protecting your eyes from the sun.
Oh yeah, the sun.
And I mean always, not just on sunny days.
Well, Lily.
Yeah, those harmful UV rays can penetrate clouds and damage the delicate structures in your eyes,
So sunglasses, even on cloudy days.
especially on cloudy days. Think of it as sunscreen for your eyes. And don't forget a wide-brimmed hat for extra protection.
Fashionable and functional. Okay, I'm gonna guess smoking is bad for your eyes too.
You guessed right. Smoking increases the risk of several eye conditions, including macular degeneration and cataracts.
Not good. Another reason to kick the habit. Anything else we should be mindful of in our daily lives?
Well, for those of us who spend a lot of time looking at screens,
Which is pretty much everyone these days.
exactly. It's important to take breaks and look away from the screen every 20 minutes or so.
Ah, yes. The 20-20-20 rule. Look at something 20 feet away for 20 seconds every 20 minutes.
That's the one. It helps reduce eye strain and prevents those annoying headaches.
So many good reminders here. Regular checkups, sun protection, no smoking breaks from screens. It all adds up.
It really does. And remember, if you notice any sudden changes in your vision, don't wait. Contact your eye doctor right away.
Always better to be safe than sorry.
Exactly.
We've talked about avoiding strain after surgery, but what about exercise? Is it okay to work out if you have one of these eye conditions?
That's a great question. And the answer is, well, depends. Well, first and foremost, you need to talk to your doctor.
Okay.
They'll consider your specific condition and advise you on what activities are safe.
So no hitting the gym without the doctor's permission.
Exactly. Once you have the go-ahead, Then you can think about the type and intensity of exercise.
Give me an example.
Well, let's say you've had retinal detachment surgery. High-impact activities like running or jumping might be off limits for a while.
Makes sense.
Yeah, because of the potential for jarring and putting pressure on the eye.
Right.
But gentler exercises like walking, swimming, or cycling could be perfectly fine. It's all about finding that sweet spot, staying active without putting your eyes at risk.
Finding that balance.
Exactly.
And I imagine there are ways to modify exercises if your usual routine is off limits.
Oh, absolutely.
Hmm.
There are always alternatives and modifications. It's all about being flexible and finding what works for you.
I like that approach. You know, we've been focusing on glaucoma, retinal detachment, and macular degeneration. But what about other factors that can impact vision, like diabetes, for instance? Ah, good point. Diabetic retinopathy is a serious complication of diabetes that can damage the blood vessels in the retina and lead to vision loss.
So it's a whole other thing to be aware of.
It is. And it's another reminder of how interconnected our health is. What affects one part of our body can have significant consequences elsewhere.
The domino effect, right?
So managing chronic conditions like diabetes is super important, not just for overall health, but for protecting our vision, too.
Absolutely. And those regular eye exams we talked about are even more crucial for people with diabetes.
You got it.
Okay, so many good takeaways. Regular checkups, a healthy lifestyle, managing any underlying conditions. It all comes back to that holistic approach.
You've got it. It's about being proactive and taking a comprehensive approach to protect our precious sense of sight.
Well said. This conversation has been so eye-opening, pun intended.
I'm glad to hear it.
We've learned about the complexity of the eye, the seriousness of these conditions, and the importance of proactive care. But I think we've also gained a sense of hope, knowing that research is always pushing the boundaries. That's the exciting part. There's always more to discover.
And that brings us to part 3 of our deep dive, where we'll explore the latest research promising new treatments and what the future holds for preserving our vision. Stay tuned. Welcome back for the final part of our eye health deep dive.
It's been quite a journey learning about all these conditions.
It has, and now it's time to look ahead.
Yeah, to explore the cutting edge of research and innovation in eye care.
Okay, so what's on the horizon? What are you most excited about?
Well, one area that's really taking off is gene therapy.
Gene therapy for eye conditions.
Exactly. Scientists are developing ways to deliver corrective genes right into the eye.
To treat
Inherited retinal diseases.
Wow, so it's like fixing the underlying genetic problem.
That's a great way to put it.
Yeah.
And the early results are very promising.
That's incredible. Potentially curing inherited blindness.
It's pretty amazing. And it's not just gene therapy. There are also big advancements happening with stem cell research,
Oh, wow.
artificial vision systems, and even personalized medicine tailored to an individual's genes.
It sounds like the future of eye care is very bright.
I think so. And these advancements could not only treat existing conditions, but maybe even prevent them altogether.
So early detection is still important, but early intervention could become even more powerful.
Exactly.
So where can our listeners go to stay up to date on all this research?
The National Eye Institute, the American Academy of Ophthalmology, they're great resources. And you can always check out reputable science journals like Nature and Science.
Great tips. Thinking about all this makes me wonder, what can our listeners do right now besides regular checkups and healthy habits to advocate for their eye health?
One of the most important things is to talk to your family about your eye health history.
Oh, interesting. Why is family history so important?
Well, because a lot of eye conditions have a genetic component.
So if your relatives have had glaucoma or macular degeneration?
Exactly. That information can help you and your doctor understand your risk.
It's like putting together a puzzle. Each piece of family history gives us a clearer picture.
That's a great way to think about it. And advocating for your eye health also means asking your doctor questions, staying informed about your treatment options, being an active participant in your care.
Not just a passive patient.
Exactly.
This whole conversation has been eye-opening, pun intended.
I love it.
We've learned about the complexity of the eye, the seriousness of these conditions, but also the incredible progress being made in treating and preventing them.
It's a really exciting time for eye care.
It is. So what's the one key takeaway you want our listeners to remember?
Your vision is precious. Protect it. Get regular checkups, take care of your overall health, stay informed, and be an advocate for your own eye care.
Great advice. And to all our listeners out there, keep those eyes healthy and keep exploring the world around you.
And we'll see you on the next deep dive.